Hi there. In honor of Maternal Mental Health Awareness Week, which is this week, I'm popping on to do some videos to help you become more aware of maternal mental health. Yesterday, I answered the question, what is maternal mental health? And today, I'm going to go through some of the common signs and symptoms. My hope is that you being more aware that you will be likely to ask those around you who have recently given birth how they're doing. And you could identify whether or not that woman or family might need some extra support. And then you can be the key to bridging that woman or family with the support and resources they need. This is, a very important topic, and it's very prevalent, and I'm excited that you're tuning in. So let's get right to it. Typically, after birth, about 80% of new moms experience what we call baby blues. This is really common. This is when a woman might be weepy, have some mild mood swings, irritability, some anxiety. They're kind of up and down. The symptoms are mild, but they're noticeable. We don't consider this a diagnosis, but these symptoms can be alleviated with support from family and friends. So moving forward, 3 to 4 weeks postpartum, if these symptoms are still there, they're persisting, or they get worse, that's when we look at, is this something else? Is this postpartum depression or postpartum anxiety? And for today's quick video, I'm going to go through what the symptoms can look like for depression, anxiety, and OCD postpartum. In depression, a woman experiences severe sadness. Maybe she has crying spells. She might have a hard time getting out of her bed, does not want to hang out with her family. She's withdrawn. Her appetite's all funky, loss of interest just in general things, might be having a hard time bonding with baby, and she's just really sad and down. In severe cases, moms can experience suicidal thoughts, and we need to give that attention immediately, right away. One other symptom of depression that you might not be aware of is anger. Anger is a symptom of depression, so that's something to take note of. Moving to anxiety, postpartum anxiety can look like a woman who is experiencing a lot of worry, excessive worry, racing thoughts. The mind is having a really hard time slowing down. Maybe that mom is really irritable, having a hard time sitting still, loss of appetite, nausea, and they're having a hard time sleeping, which, if you ask any new mom, they're going to say they're not sleeping well. But the key with anxiety is if this mom is given the opportunity to rest, but she can't because she can't quiet her mind, that's something to pay attention to. Then we have postpartum OCD, another common diagnosis. And this mom may have all the symptoms I just mentioned with anxiety, but they also have some intrusive, disturbing thoughts. These thoughts are repetitive thoughts, typically that have to do with something happening to baby or themselves. And they're really upsetting and they're really disturbing. They could be thoughts, they could be images, and these thoughts and fears typically lead to compulsive behaviors. And moms think that if they do these compulsive behaviors, this will protect their baby or themselves. In essence, they think that if I do this, this is going to alleviate some of my fear and obsessions. So those are the 3 diagnoses I'm going over today. There are a spectrum of diagnoses postpartum, but I wanted to give you just a little bit of information about the top 3. If you want more information, I would encourage you to go to my website, postpartumatlanta.com, or go to Postpartum Support International at postpartum.net, where there's a lot of information on all of the diagnoses, the risk factors, and the symptoms. Tomorrow, I'm going to talk about if you know someone or you are suffering with any of these symptoms, how do you treat it? What are some treatment options, referrals, and resources? And I'll include lots of links and good information then too. So I appreciate you taking the time with me today to become more aware, and I look forward to popping on tomorrow as well. Of course, any questions, I'm happy to answer at any time. Take care and be well.